Hello, I'm Yasser Janab, interventional cardiologist in Tehran Heart Center, presenting the topic Anatomical Variations for Infra-popliteal Intervention. With chronic total occlusion as well as diffuse diseases in below arteries, understanding the predicted course of infra-popliteal variants can be very challenging. A lack of awareness of infra-popliteal variant vasculature can result in a missed endovascular treatment opportunity, failed intervention, and serious complications. Normally, the popliteal artery is the continuation of the superficial femoral artery. Afterwards, it divides into the anterior and posterior tibial arteries. The anterior tibial artery passes in front of the ankle to the dorsum of the foot as the dorsalis pedis artery. The peroneal artery arises about 2.5 cm distal to the popliteal muscle from posterior tibial artery. There are three different branching patterns of the popliteal artery. In type 1, branching of the popliteal artery at the normal expected level, that is below the level of medial tibial plateau. In type 1a, the first branch of the popliteal artery is the anterior tibial artery with the continuing segment of the main artery known as tibio-peroneal trunk, further divided into peroneal and posterior tibial arteries. In type 1b, branching of anterior tibial artery, posterior tibial artery, and peroneal artery is within a distance of half centimeter without formation of a true tibio-peroneal trunk. And finally, in type 1c, posterior tibial artery is the first branch, and anterior tibial artery and peroneal arteries arise from the tibio-peroneal trunk. In type 2, there is branching of popliteal artery above the normal level, and in type 3, it is hypoplasia or agenesis in the branches of popliteal artery with an alteration in distal blood supply. Type 3a, distal distribution of posterior tibial artery by peroneal artery aligned with hypoplastic or aplastic posterior tibial artery. In our case, which is type 3b, it is substitution of the dorsalis pedis artery by peroneal artery aligned with hypoplastic or aplastic anterior tibial artery. And in type 3c, distal distribution of posterior tibial artery and dorsalis pedis artery by peroneal artery in conjunction with hypoplastic or aplastic anterior tibial artery and posterior tibial artery. Our case is a 64-year-old lady. She had diabetic foot ulcer on her toe. She had history of diabetes mellitus and she had CABG history. Angiography showed the arteries of the crural region arose from the popliteal artery as usual. The anterior tibial artery seems hypoplastic or occluded at distal portion. Posterior tibial artery had a normal course and distally divided into medial and lateral plantar arteries. Diagnostic angiography by the ipsilateral approach showed probable total occlusion before dorsalis pedis artery. We decided to attempt recanalization of chronic total occlusion in the distal anterior tibial artery to the dorsalis artery to establish one straight line fellow to the foot, crossing of the occlusive lesion using the coronary technique with a 0.14-inch guide wire as Regalia and halberd supported by 2 mm lined OTW balloon was unsuccessful to pass from anterior tibial artery to dorsalis pedis. Careful reviewing of the images revealed probable continuation of peroneal artery to dorsalis pedis artery as type 3b anatomic variation. Wiring was made along the peroneal artery tract to the occluded segment into the dorsalis pedis artery followed by balloon dilation. The total occlusion lesion was completely recanalized without dissection and residual stenosis. Final angiography showed an excellent result indicating a type 3b variant. As in type 3b, the peroneal artery continued as dorsalis pedis artery. Posterior tibial artery had a normal course and distally divided into medial and lateral plantar arteries. You can watch the final. In this table, you can see reports of variations of branching pattern in the popliteal artery. In summary, an increasing popularity of catheter-based intervention heightens the importance of a more robust awareness of infra-popliteal variants for increasing the success rate of revascularizations. Thanks for your watching.